Next, Representative Thanedar offers amendment number 5 for the substitute H1 for House Bill 5784. Would you like to discuss your amendment?
Yes, sir. Thank you, Chair Albert. I want to start with expressing my appreciation for Committee Chair Mary Whiteford. I appreciate her passion and her hard work and all those great presentations she organized to educate us. So I truly appreciate that. My concern currently is that we do not have sufficient psychiatric beds in Michigan serving the 10 million people. There has been a decline in mental health funding over the years. And there are horror stories where grandparents are waiting for a hospital bed for their child suffering from mental illness. And there are cases where kids are piled up, stacked up in emergency rooms, some for days, some for weeks. Parents calling different places and being told to pass from one place to another. The frustration for the parents of not being able to get the services their child needs. This is the time where we have budget surplus. This is the time we have gotten unprecedented money from the federal government. And this is the time for us to invest and provide these services, which is substantially underfunded. So my amendment calls for additional bed capacity in terms of capital investment. You know, we have a significant discrepancy in the services that we provide for these children, and we have not yet seen the impact of the COVID pandemic on the psychiatric needs of our children. So once that hits, it's going to be even worse. And I am really concerned at this stage that this budget doesn't go far enough to help our children, to create the capacity to serve our children. And we're going to be facing the next pandemic. From COVID pandemic, we are going to go into a mental health pandemic, which is really what we need to prepare ourselves for. And I feel that this budget doesn't go far enough. And so I propose my amendment that will put not only money for additional beds, but also money for mental health services for students and teens. So with that, Mr. Chair, I move my amendment.